Hello, my name is Angela Bartson, and the career I wish to pursue is physical therapy. So as a physical therapist, their scope really entails that they are healthcare professionals who help people with limited mobility. A couple of reasons why one might go see a physical therapist is due to an accident, maybe they've fallen or something, a sports injury, or maybe someone has diabetes where they have lost sensation in their feet. So it's their job to reduce and eradicate function impairments, manage and better a person's movement and activity level, and that they are also fundamental providers of rehabilitation. Physical therapists and occupational therapists are both essential people to see during that time of rehabilitation, because it's their overall goal to enhance one's health, well-being, and quality of life. So some people that you might interact with is you yourself, the physical therapist, your patient, and sometimes a physical therapy assistant. If you're going to go into this field, it's important to know that you will have a very close one-on-one relationship between you and your patient, so you should be okay with that. Some duties they might do day to day is explain to the patients about their condition and create an individualized treatment plan. It's important during that time to get to know your patient and their condition to create that customized plan, because what may have worked for someone else with the same condition may not work for them. So really get to know your patient. And then also demonstrate exercise movements, show them how to do it, let them do it for you, and talk about where they should be feeling it. It's their job that they want to challenge you, but definitely don't want to overwork you. And also monitor a patient's progress toward a goal. See their timeline. See if they're hitting those milestones. And if it's taking too long, change it or revise it to get them back on track. And also communicate to the patient or the patient's families about in-home exercise techniques. Discuss what you can do when you're not here. What can you do in the comfort of your own home? And usually these techniques are very simple. They only involve your body weight, so they're very manageable to do. A couple of places you might find a physical therapist work is the hospital, although it is not the most common place that they work. I did want to mention that. Outpatient clinics, a big one here is the Florida Orthopedic Institute. They have quite a few locations located across Tampa, so maybe you, a family, or a friend has gone there before. And then also private practice. Some physical therapists do open up their own private practice. And then I also wanted to mention a couple of specialties that you can go into. One is neurology, working with patients that have had strokes or have suffered from other traumatic brain injuries. And then also the ICU or emergency U, places like that where physical therapy will definitely be essential during their treatment plan afterwards. So how to become a physical therapist? So the first three, obtaining a bachelor's degree, taking the GRE, and getting observation or volunteer hours, there's all things you want to do before you apply and then are admitted into a physical therapy school. So it's important to do your research and research the schools that you want to apply to, because some of them do or don't require things like volunteer hours or letters of recommendation. But it never hurts to do them anyways. So after being admitted into your school, it takes about 3 years, and then after that, you get your doctorate in physical therapy, your DPT, and then from there, you can apply to get your state licensure. All states do require a license to practice, so it's important to know that. Personally, for me, from now until May 2020, when I graduate, I'll be doing things like taking the GRE, shadowing a physical therapist, and getting those observation and volunteer hours. And then after I graduate in 2020, between applying and interviews, it'll probably take a year, so 2021 we're at now, and then being admitted in 2022. Takes 3 years, like I mentioned, so graduate in 2025 to get my DPT, and then follow the timeline, state licensure, and be able to practice. And here pictured is USF's class of 2019 physical therapy students during their white coat ceremony. So how can you better your career? It never hurts to be more involved. So for first things first, continuing education requirements, they do vary by state. So look into which state that you're going to live in to see if you do or don't need to further your education to maintain your license. Florida is one of those states that do need to follow up yearly. And then also optional things to do after you graduate is complete a clinical residency or fellowship. Next, like I mentioned before about specialties, you can become a board-certified clinical specialist. And to do that, you have to pass an exam and complete about 2,000 hours of clinical work. And you have to do that all within the 10-year span of getting your DPT. And then a couple of organizations is the American Council of Academic Physical Therapists, ACAPT. So they are partners and work very closely with the American Physical Therapy Association. And then also the Physical Therapy Political Action Committee. So it's their job and goal is to influence legislators to champion for physical therapy legislative interest at a federal level. It's a great way to be involved with not only your career, but also government to really rally for what you believe in. So these are all things that you might want to consider or things you want to know if you're going to follow this career of a physical therapist like I am. Thank you.